If you've been thinking about starting a GLP-1 medication, you're probably wondering, should I take the pill or the injection? Maybe the thought of giving yourself a weekly injection makes you nervous. Or maybe you're wondering if the pill is just as effective. Today, we are breaking down the similarities, the differences, the benefits, and considerations of both options so that you can have a more informed conversation with your healthcare provider. And be sure to stick around until the very end because I'll also share with you how you can improve your chances of long-term success on GLP-1 medications, regardless of which form you use. So, if that sounds like something that you're interested in, keep on watching. Welcome back to my channel. If you are returning, if you are new, welcome, welcome. My name is Carmen Walker. I'm a certified health coach, life coach, and expert weight loss strategist for pre-diabetic and type 2 diabetic women. I'm so glad that you're here. Today, we're going to be talking all about comparing the GLP-1 pills to the shots and giving you all of the info, spilling all the tea to help you make an informed decision with your healthcare provider, of course, to decide which one is best for you. So, I help type 2 diabetic women create sustainable habits that support their blood sugar management and long-term weight loss. You heard that right, long-term weight loss success. So one important point before we begin, this video is for educational purposes only, okay? The best medication for you will depend on your medical history, your treatment goals, and the guidance, of course, from your healthcare provider, okay? So let's get into it. Let's start talking about comparing the two options. So first of all, I want to start off with what GLP-1 medications are. GLP-1 medications mimic a hormone in your body that naturally produces and helps to regulate your blood sugar and your appetite. Now, depending on the specific medication that you choose, this may help increase your insulin release when blood sugar is elevated in your body, reduce your glucagon production, okay, slow your stomach emptying after you consume a meal, increase feelings of fullness, and also reduce food cravings. Now, these effects can help support blood sugar management and for many people, meaningful and significant weight loss when combined with healthy lifestyle habits, okay? So let's start talking about GLP-1 injections. Now, the injectable GLP-1 medications are often given once a week, though some are taken daily depending on the product, okay? Many people like injections because it's a weekly dosing and it can be convenient. They don't require a daily routine, most of them don't, and then some injectable options have shown substantial weight loss benefits in clinical studies. Now, here's some of the challenges. Fear of needles, injection site discomfort, okay? You gotta be sure to rotate it just like you would if you were taking insulin. You gotta remember weekly dosing, and it could have some gastrointestinal side effects such as nausea or constipation, okay? Now, many people find the injection process easier than expected because the needles are very small, but comfort levels vary from person to person, okay? So that's what you need to know about the GLP-1 injectables. By the way, you guys, GLP-1 stands for glucagon-like peptide. 1, okay? And it is a natural hormone that is secreted in our bodies. However, a lot of times if you have type 2 diabetes, this hormone is not producing properly in your body. And so these injections or pills, whichever GLP-1 medication you and your doctor may decide that is right for you, it's going to help mimic the hormone that your body already produces, okay? Now, let's talk about effectiveness. Which is more effective? This is one of the more common questions that I get, okay? And the answer honestly depends on specific medication that your doctor may prescribe for you, the dosage, and your individual response. Some injectable GLP-1 medications have demonstrated greater average weight loss results in clinical trials than currently available oral GLP-1 options, okay? However, effectiveness will vary, and individual results will depend on many factors, including nutrition, physical exercise, sleep, stress levels, adherence to your medication regimen, and your overall health. Okay, so no medication, and please remember this, no medication replaces healthy habits. Okay, a GLP-1 can be a powerful tool, but it works best as a part of a comprehensive approach. Okay, and that's something that you and your healthcare provider can structure for you and for your particular situation. Now, as far as to which one will fit your lifestyle, think about questions like, would you rather take a medication every day or once a week? Are you comfortable with injections? Can you consistently follow timing instructions for an oral medication? What goals are you trying to achieve? And what does your healthcare provider recommend based on your particular medical history? The best option is the one that aligns with your health needs and the one that you can consistently use under medical guidance. Okay? Now, here are some common questions that I get from my clients regarding GLP-1s. Can you switch from a pill to an injection? Sometimes yes, but only under the guidance of your healthcare provider. Another question, will the side effects be the same? Many GLP-1 medications share similar gastrointestinal side effects, although the experience can vary from person to person and from one medication to another. Now, will you still need healthy eating habits? Absolutely. Medication works best when it's paired with balanced nutrition, regular movement, adequate sleep, and stress management. Okay, I cannot stress these enough. Now, I know that I'm gonna back up a minute. I know we talked about GLP-1 injections. Let's briefly talk about GLP-1 pills. Okay, now oral GLP-1 medications can be a good option for people who prefer not to use injections. Some don't like needles, that's perfectly fine. Now, the potential advantages of the pills for GLP-1s are no needles, familiar daily pill routine, right? And then convenient for those who are uncomfortable with injections. However, I want you guys to know, some oral medications have specific instructions, such as taking them on an empty stomach with a small amount of water and then waiting before eating or drinking anything else. Following those directions consistently is important for the medication to work as intended. Okay, so that's a side note. Also understand and remember that daily dosing may also be harder for some people to remember than a once weekly injection. Excuse me. Okay, so I just wanted to briefly go over some of the benefits and the challenges for taking the GLP-1 pills. Now, I want you guys to understand, whether you choose a pill or an injection, remember this: your medication is a tool, not the entire plan. Long-term success comes from building habits that support your health, even beyond medication. I want you to focus on consistency rather than perfection. Those of you that know me by now and have been watching my videos and following me, you understand that I will preach consistency all day because it is so important. It's not about what you do, it's about what you consistently do that's either going to move you towards your weight loss goals and help you get there and stay there, or it's going to be what you consistently do or don't do that will move you away from your health and weight loss goals.